And heart attacks, when people come, time plays a huge role and huge factor there. Okay. First 12 hours is called as golden window. Okay. Why? When a 100% occlusion happens, when a heart attack happens.
When you say occlusion, it's 100%
blockage. Yes.
Okay.
Okay. Happens. That particular territory is not getting blood. Every minute, every second we delay, the complications are going to be higher. The amount of muscle that I'm going to recover is going to get delayed. When I mean complications, what do I mean? The BP can go erratically low. That is called cardiogenic shock. That is the worst thing as a cardiologist I would want to happen in my patient. Okay. Then second, what can happen? Electrical disturbances can happen. The heartbeat can go erratically high or erratically low. Third thing, what it can happen? It can create a hole in the heart. Between two chambers, holes can form. Worst complication again. And heart itself can tear off. Okay. We call it as VSR. Okay. So these are all the worst complications that we see in patients when there is a delay in presentations.
So the golden is 12 hours. So immediately going really helps.
If you go in first 1 hour or 2 hours, as much as possible, the heart pumping can be recovered. The later you go, the later we intervene, the pumping, if you go at 40%, we will not be able to get it back to your routine 60 or 65%. And not only that particular territory which is not contracting, that particular area, the muscle is dead. That can become thinned, that can become scarred. If it becomes scarred from there, another electrical activity can start from there. That can cause a lot of problems in future.
Okay.
And you spoke about cardiac arrest. This pumping capacity, when it goes less than 35%, and after giving all drugs to you, after 40 to 50 days, or say after 90 days, if your pumping capacity is not recovered and it is still less than 35%, that person is at higher risk for cardiac arrest anytime. Then I'll have to put an in-house, like how we shock, you see in movies, no? We shock and they recover patients. You'll have to put an intracardiac defibrillator, something like a pacemaker device inside their heart that works as a defibrillator, watches out for electrical arrhythmias to give shocks. Okay. So
the golden hour is very important.
Very, 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 very important.
Can you also tell me a story where people came last minute? And
this is a very recent thing. A 62-year-old lady.
62-year-old lady, okay.
She had some மூச்சுவாங்கல் she had for last 1 week to 10 days. It suddenly worsened from today morning. And she goes, she says to her daughter, I feel very uncomfortable right now. And they go immediately to a next door hospital. They say your thing looks very abnormal. You need to go to a higher center. We'll arrange an ambulance. We'll resuscitate. They say no. I want to go immediately. Took her in her own vehicle. Daughter's bringing her. She started losing consciousness on the way. Okay, brought into the hospital in a gasping state. Okay, and cardiac arrest. BP is not recordable. She was not conscious. We did CPR. 6 cycles of CPR was done. We reverted her. Put her on a ventilator. I took her on for an emergency procedure. And one of the vessel was problem. Fixed that vessel. Patient's BP started improving. Over next 24 to 36 hours, her entire cardiac status is stable. Her whatever kidney injury was there, that recovered. Her liver injury was there, recovered. I've told you all the good parts. Right when we were resuscitating her, I had something in my mind, because she was not an unconscious person who arrested in front of our eyes and we resuscitated her.
Which means you didn't see her when you went through. Correct.
Yes. Got it. The moment when she came itself, she was in an arrested state. The information we have is somewhere between 15-20 minutes back, she was in a nearby hospital where she was conscious. That is what the attendants say. But the time is 15 minutes. Okay. What happens is more than 9 minutes, if you're in an arrest state, your brain can go for a damage, permanent damage. Your brain does not get enough blood
supply.
Okay. So now we've reverted all those things. I've discharged that patient a day or 2 days back. She's gone for an hypoxemic encephalopathy. Her brain has gone for an hypoxemic encephalopathy, where brain did not get enough oxygen. The CPR should have been started earlier for her. We've saved her life. She's not technically brain dead. Her brainstem reflexes are all intact. But she's in a vegetative state.
Okay. So she's functioning, but
her organs are functioning. Her brain is gone for complete hypoxia.
So we don't know what will happen. We hope and
And-
pray that it recovers.
I don't think so. That is what the experts, neurologists say.
So what could have been done to save this? One is preventive, of course, we know. But once the pain comes, they should have come directly.
They
or
should
what?
you should reach the right place. That is one. Or second thing, you should have allowed the other hospital to at least resuscitate you. Okay, you chose to go there, and this was told by the family only. They said they would resist. They did not.
What
want,
does resuscitate? Can you explain?
see, they would have seen that her stats were not good. Maybe the BP was down there only. Maybe she was desaturating there. They would have probably put her on a ventilator there. They would have given her supportive BP drugs and shifted with medical professionals from there. In case if she had gone for an arrest in between, they would have given her CPR and other things. So that would have, because the entire course is good now. It is not, we cannot say we don't know. The entire course is good now. We've saved her heart. We've got her lungs to do well. We've got her kidneys to flow well. Everything is normal.
But 15 minutes, that's where the problem is.